Well, most of us have never lived through anything like this, and many of us have a lot of questions about it. So we are putting facts ahead of fear and bringing you answers that can help you and your family keep all of you safe. Well, this morning we are joined by a medical expert, Dr. Arnold Baskies, a surgeon from New Jersey. Dr. Baskies is joining us live. Good morning.
Good morning.
Our first question is about today, Easter. It is Easter Sunday, and although a lot of church services are being held virtually this year, there are other traditions as well. People may be tempted to visit grandparents or let the kids take part in an Easter egg hunt beyond just their backyard, but of course those things are not recommended. So what do people really need to keep in mind?
So at this time, we know that the disease is plateauing. In fact, in New York and in New Jersey, we're seeing that effect. So we know that social distancing and we know that frequent hand washing work. If we bring large numbers of people together at this time, we can completely overcome the system again. So it's very important that we maintain social distancing for now. This is a tough time, no question, for Jews Passover and for Christians Easter. But it's very, very important that we not bring large groups of people together as much as we want to be together at this particular time. We are plateauing as a country now, not just in New Jersey, not just in New York, but around the country. And that shows that this type of technique works. We've known that it works because of other epidemics in the past. So the message should be stay the course.
And Dr. Baskies, as we look at these numbers, reports are showing that the African-American community may be getting hit especially hard by the coronavirus. What are some of the factors that could be leading to that?
So there's a thing we call social determinants of health, defined by the American Academy of Family Practice. And in addition to that, the American Cancer Society, we have been paying close attention to these social determinants of health. There are about 18 of them, but the big three are access to health care, socioeconomic status, and education and health literacy. But when you add into that the comorbidities that seem to be frequent in the African American and Hispanic community, such as obesity, diabetes, and hypertension, and the inability to telecommute. Remember, a large percentage of our population is currently staying at home and telecommuting. If you're unable to do that because of your socioeconomic status or because your job requires you to commute in a group, like on a bus, on a train, et cetera, then you will see higher rates of COVID in that population. And unfortunately, there is a disparity in the numbers. We don't have the exact numbers, by the way, from New York, but everything seems to indicate that the African American community and the Latino community have been disaffected to a larger extent by this disease process. But the reasons are chronic conditions and social factors that make this a much more dangerous situation in that population.
Okay. Let's talk about testing. One thing that came up recently, we recently learned a tiger at the Bronx Zoo tested positive for coronavirus, right. And that had people asking questions about how you could test this tiger when many people were having trouble getting a test in their communities. What does that tell you about the availability of testing, or does it tell us anything?
Well, that's the famous tiger story. It's not that common. But let's just look at the history of testing in the United States. On March 6th, we began to test. By April 6th, which is a month, 30 days later, we've had over 2.5 million people tested. So we have really ramped up. Do we have enough testing? No. Tony Fauci himself has said and testified in front of Congress that we weren't ready in terms of the testing aspect of this, of monitoring this disease. But every single day we're seeing more and more tests being done. Remember, we live in a population of 324 million people. It's the largest population in the Western world, of the Western nations. We have the largest population, so it's taken time to ramp up, unfortunately. But we're moving in that direction. Do we have enough testing? Absolutely not. But one of the good things to know is that we're also starting to do antibody testing. The first antibody test to see if you have immunity to this disease was FDA approved on April the 6th. So we're getting to where we need to be. Are we there yet? Absolutely not. Nobody claims that. But we've gone from 0 tests to 2.6 million tests in about 30 days or so. So we're making a lot of progress.
All right, something that we're going to continue to watch. And Dr. Baskies, we will check back in with you in just a little while. We've got more questions for you. Thanks so much.
Thank you.
People are posting on social media about it. They're wondering if you maybe had a round of illness back in November or December. People wonder, could they have actually had the coronavirus? And if they did, could they now be immune to what we're seeing now?
There's two answers to that question. First of all, it's more likely if you had something that imitated the symptoms you have, it would be statistically more likely that you had the flu than you had coronavirus infection. We know that this disease started in China, in the Wuhan province. We know that it began to spread probably as early as November or December, based on people traveling out of that area. And after Chinese New Year's, there were more people that traveled out. But the influx of disease seems to have come from Western Europe more so than from China. So at the end of the day, if a person got sick in November or December, it's more likely that it was another disease rather than the coronavirus. It's wishful thinking, I think, to more or less, to some degree at least, to think that if you became ill in those months, that it was from corona. Is it possible? Yes. If you had it, yes, you're more likely to be immune. And if you do get it, how long does the immunity last? Well, this particular virus belongs to a family called coronavirus. It's actually called SARS-2. So we know from SARS and from MERS, which are also in the coronavirus family, that immunity lasts somewhere between a year to 8 years from the best studies that we know. So if this virus is like that one, immunity would last somewhere in that wide range. But how long it lasts, we don't know yet, because it's a brand new virus.
Okay. A lot of people are wondering when things are going to return to some semblance of normalcy, but let's talk about what that might actually look like. Could people go back to work if they are wearing masks, if they're not shaking people's hands? What will this look like?
The way we go back to the way we were before is going to take time. We won't be completely safe until we have a vaccine. And even then, we will still have some disease because there'll be some people out there who will refuse to be vaccinated. But at the end of the day, how do we decide when it's safe to go back to work? Well, and to leave our domiciles. And there are probably 4 standards that are the base for making that decision. Number one, when hospitals can safely treat all the patients without resorting to crisis standards of care. Number 2, when an individual state is able to test people, everyone who has symptoms. Number 3, when an individual state is able to conduct monitoring of confirmed cases and contacts. And number 4, when there's a sustained reduction in cases for at least 14 days. And the reason for that is that it takes about 14 days, up to 14 days, before someone can have symptoms. How we get back is really a question that's evolving now. Remember, we've never, ever, ever shut down an entire country. Forget the country. We've never, ever, ever shut down the entire world from a disease process that all of us can be exposed to. So the way we do it is we try to figure out how to gradually get back to some semblance of what's normal. Yes, will people be wearing masks more frequently? The answer is yes. Will people's desks be more separated? Yes. Will there be more telecommuting? Yes. The way we get back to this will be gradual. It will be compartmentalized. And a lot of our methodology will evolve from the task force in Washington. So it's a little bit early to try to figure that out, but there is some good news. We have over 240 companies right now think about that. 240 companies right now in the United States alone that are working on a treatment for this problem. It would be, and this past week, the New England Journal of Medicine published an article on remdesivir, which is an antiviral that was used initially in Ebola and was used in patients who were very sick. And it had a tremendous effect. But again, this wasn't a randomized study, so it's a little bit too early to get too enthusiastic about that particular drug. But at the end of the day, when we have an effective treatment and we have a vaccine, we will be able to do a lot of the things we were doing before. But until then, it'll be a compartmentalized, get back to normal point of view. It will be somewhat different, and we probably will be avoiding large gatherings for a while.
Let's talk about access to healthcare. Access to healthcare is an underlying problem, especially in our minority communities. We've talked about that this morning, and we also talked about the importance of testing. So what needs to happen to make sure that there is equal access to both care and to testing?
One of the problems that we have right now that we're facing is we don't know how many people in any community, whether it's a minority community or in the communities, all of the communities that we deal with, we don't have an idea as to what the positivity rate is. So we need to make sure that access to testing is available to all of the communities that we're interested in. There is no question right now that the most disadvantaged communities, if you are racially, are our minority communities. And that has to be addressed very effectively. So we have to make sure that we have places that they can get to that are convenient and accessible, so that we can actually figure out where the outbreaks are, who's positive and who isn't. And then we can isolate those people and do a much better job at that. Have we done a great job to date? No, we haven't. But that shouldn't be an impediment to working harder to do that. And certainly the most disadvantaged among us need to be addressed as quicker than anybody else.
Okay. A lot of us, we're all spending a lot of time with those in our immediate households. And for so many people, their pets are part of those families, part of those households. We talked this morning about how a tiger tested positive at the Bronx Zoo for coronavirus. So what does all of this mean for our pets? What can we do to make sure they are safe as well?
Right. So the most famous animal in the whole country right now is Nadia the tiger in the Bronx, which nobody ever heard of. Yes, that tiger did test positive after 6 other big cats at that zoo had become ill. So the first case of an animal testing positive, think about this, in the whole country, was this tiger. We do not have any evidence that companion animals can spread COVID. It's very important that people understand that. Animals are not the cause for this problem. Pets are not the cause for this problem. Can a pet test positive if they're in a household with someone who has COVID? The answer seems to be yes, that is possible. The CDC is aware of a very small number of pets outside of the United States who are reported to be infected with the virus after close contact with people who had COVID. So don't kiss your animal. Don't share food with the animal. But certainly the animals that we live with, our companion pets, are not the source of this problem. And that has to be recognized. So it is possible that an animal that you're in contact with, if you are positive, can become positive. So the same social distancing in a household needs to be done if you are living in a house and you with an animal and you are COVID positive.
All right, Dr. Baskies, thanks so much for your time and your answers today.
Thank you. Thank you very much.